At that point of time, we never wanted to be a company which would license out this technology and would tell the other people to do some or manufacture certain devices. Since the beginning, we were a part of an infection prevention control was our aim, our mission, and we were working on that. And after getting a patent of nanoagicide, we just thought of solving a problem in this infection prevention and control area. So during that times, like maybe a few years back, when we used to interact with a lot of doctors and fellow colleagues, we could hear a lot of words like HAIs, that is hospital-acquired infections, CAUTIs, that is catheter-associated UTIs, and UTIs, that is urinary tract infections. So we just one day we had just sat down and we just thought that can we have a product in such domain which could be very helpful, because this problem looks very genuine and it is a widespread problem in India and in the global market also. So this is where the concept of making an antimicrobial catheter was actually being realized. And then fortunately, we found a manufacturer who was generous enough to help us in making the initial prototypes. And the prototypes were being extensively tested in our lab. And then the first activity which they show, which they had shown was an antimicrobial activity. And there we got the confidence that yes, we can go ahead with making the catheters as antimicrobial in nature. So this is just a journey from where we started by making nanoparticles and then now working in infection prevention area, coming up with a marketed device which is SilverGuard antimicrobial Foley balloon catheter, and many devices in pipeline to go ahead. So we'll start with the presentation. My name is Dr. Prasad Bhagat. I'm CTO of Venovat Biosolutions Private Limited. Me and Milind are from the same lab. Our PhDs are also in nanoparticles and nanotechnology. My PhD was in therapeutics, in which carbon nanospheres were used to treat cancerous cells. And then later on, immediately, we had written a project for BIG. We got funded for it. And that is how the journey started. So now you have understand the problem of hospital-acquired infections and what is CAUTI, what is UTI, and how severe this problem is. Now, to tell you the solution, what we have got for it is SilverGuard antimicrobial Foley balloon catheter, which helps in preventing infections and enriching life. This is our motto. So the SilverGuard Foley catheter is of superior quality because the raw material which is being used is superior quality of latex is used. The manufacturing, as we have seen, is a top quality manufacturing, and we have invested a lot in packaging of this product also. So we always had a motto of bringing quality product to the market. That's why we can pretty surely say that this SilverGuard Foley balloon catheter is of superior quality, with the results also what we are getting. The next important part is it is made antimicrobial by impregnating it with the patented nanoagicide technology. As I've already said that we have a patent on nanoagicide, and we were thinking of making a device out of it. And the first device was Foley balloon catheter. Normally, what you see is these catheters are being coated, but with our technology, we are impregnating silver nanoparticles in the latex so that the silver nanoparticles become a part of the latex and it has antimicrobial activity till its shelf life. So now I would stress on this third point, that is, just a second, that the SilverGuard Foley catheter remains antimicrobial throughout its shelf life. I would like to stress on this point because Milind had explained about the organic and inorganic antimicrobials, and the antibiotics fall in the category of organic and organic material, which has the ability to gain resistance. And for the organic molecules also, if it is being exposed to quite a long time, or the antibiotics also have an expiry date. But for the inorganic molecules like silver nanoparticles, you will definitely get an antimicrobial activity even after its shelf life of the product. So these are the three main attributes on which this SilverGuard antimicrobial Foley balloon catheter has been based upon. And next, would like to highlight more about the impregnation technology. So what I've said that most of the catheters which are available in the market have a coated thing, and Milind has also touched upon the issue of encrustation and issue of biofilm formation. So what happens during encrustation is the salts get deposited in the inner lining of the inner lumen of the catheter, and the catheter actually the coating can shed off because of these crystals. But the advantage of having an impregnation technology is like each layer of the latex has silver nanoparticles in it. Each layer of the catheter has silver nanoparticles in it, and all the nanoparticles have an antimicrobial activity. So even if there is any chance of incrustation and a inner layer has been removed off because of this salts, the layer underneath it gets exposed by silver nanoparticles, and they show the activity. So that is the advantage of moving into the impregnation technology. This has been impregnated, the catheter has been impregnated with the patented nano-Ugicide technology, which we have a granted patent for. And a few of the attributes of SilverGuard are the product becomes broad spectrum antimicrobial. As you already know that antibiotics are either gram positive specific, gram negative specific, or for a particular bacteria, they have been designed. But with our silver nanoparticles, they are broad spectrum antimicrobial. It doesn't discriminate between gram positive, gram negative. It will kill the bacteria, whichever comes in contact with the silver nanoparticles. And the action of the silver nanoparticles, as explained by Milind, is by sustained release of silver ions. Now, when the silver ions are being released, Milind has talked about the bullet-like action of the silver nanoparticles. I would focus more on how the silver ions actually kill the bacteria. The silver nanoparticles continuously release silver ions, and these ions are Ag plus. And what they do is they actually bind. Once the nanoparticle enters the bacteria, they bind to the DNA and they inhibit the replication of the DNA so that the bacteria doesn't propagate. That means the bacteria doesn't divide, the bacteria doesn't multiply. And this is how the role of silver ions is very important, because they actually kill the bacteria. So now coming to the next point, that is, it kills the bacteria that are into close vicinity of the catheter, because I'll explain you in a much better way this part with the data what we have, that how our SilverGuard catheter kills the bacteria which is in the vicinity. And our catheter also prevents the biofilm formation on the catheter. These two we have a very concrete data that I'll be coming up with the slides further. SilverGuard has also found out to prevent encrustation. As I've already said that it prevents biofilm formation. That's why there are less number of bacteria. If there are less number of bacteria, they don't form a biofilm. And if there is no biofilm, there is no encrustation. And recently, 2 satellite studies we have done. That data also would be, I'll be explaining you in a more elaborate way. In that, one of the parameter what we have kept was, when the catheter was removed, we actually checked for whether there is any blockage of catheter, and we didn't find any blockage in the catheters as compared to the control one. So that's why we have put here that it prevents incrustation also. And the ultimate aim of the SilverGuard Follivolume catheter is to reduce the incidences of CAUTI, that is catheter associated urinary tract infections. So just to give you an overview of this impregnation technology, it has a long-term efficacy, as already said, till the shelf life of the product. It does not promote encrustation. It has no chances of the loss of antibacterial activity, because as long as the catheter is not being exposed, the silver nanoparticles will remain there. And when the catheter is being used, the activity of releasing silver ions will take place till the catheter is in use. This technology actually utilizes the silver nanoparticles, which are evenly distributed in each layer of the latex matrix, so that the entire catheter, from the tip till the inflation and drainage funnel, everything is being antimicrobial in nature. And during the manufacturing, there is no additional step which has been required, or no modification in the instruments have been required to manufacture these type of catheters. Just to tell you about the SilverGuard unique selling points, what we have done is, after getting the antimicrobial activity, we have intensively discussed this with the doctors which are based in Pune and in the other cities of Maharashtra, in which we got some very valid inputs from them. And as you might be aware of, because Abhishek might have briefed you, you might have talked with Milind also, but I'll still be stressing on this point, is like what we have done is, balloon is close to the eye of the catheter. Now this is the eye of the catheter and this is the balloon. Okay. Now in normal catheters like Romson and other catheters which are available in the market, latex catheters, you can see that this portion has a huge height, like it has been extended till here. The eye has been punched somewhere here and the balloon lies somewhere here. Now what happens is, if the distance is more, then the tip, that is which has the eye, can have a tendency of bending down. And when it bends there, as you have seen in the video, that when the urinary bladder doesn't has urine, uh, it gets shrinked, and this tip can actually scratch on the inner lining. So what we are doing is, by minimizing this gap, we are ensuring that there is no internal damage to the urinary bladder. That's why the positioning of the balloon and the positioning of the eye is very important. The second change what we have done is, here you can see this valve. This is a plastic valve. This is one-way valve through a syringe, the balloon has been inflated. And this is how the catheter is being placed in the urinary bladder. So what we have done is, this is a double fixed valve, which actually ensures that when a balloon has been inflated, it remains in the urinary bladder without getting deflated. Because by double fixing the valve, it gives you an extra protection that there is no leakage from the balloon. Other thing what we have done is, this is the drainage funnel from where the urine actually is being drained out. And here the urine bag is being connected with a connector. So normally, if you see for some catheters, this space, this length of this drainage funnel is very less. And this was an input mostly given by the nurses and the doctors also, that when they actually insert this urine bag into this particular port, they don't have enough space, or they don't have enough material to handle this port, this drainage funnel port. So that's why we have increased the length. Now it is very easily been accessed by the nurses and doctors, and they can easily insert the urine back to it. We have extensively worked on packing, and right now the catheters which are in the market have a special non-tearable, high quality inner pouch packing, which is non-wettable and of the highest quality. We are using Tyvek paper for it, for the initial batch what we have done. And the tip what we have done is a perfectly straightened tip, which actually helps. You can clearly see that this is the tip portion. Normally what happens in most of the catheters, it is very blunt, and when it is blunt, it is very difficult for the doctor to insert the catheter in the urethra. That's why this tip has been made more sharp, so that it doesn't causes any agony while inserting, but it suffices the purpose of getting inserted into the urinary bladder through the urethra. So any questions till now?
Yeah, I wanted to ask one thing.
Sure.
Can we go to the previous slide?
Yeah. This one?
So this one. So the tip which you told, it's a straight tip. So every
Yes.
catheters come with a straight this strip only, or it comes with round strip also?
No, there are some catheters which have different type of tips. That is, Tayman tip is also there. It has a curve on it, so that if you remember, Milind had explained about BPH, that is benign prostate hyperplasia. So the what happens is that the prostate induces a pressure on the urethra, and in those patients, if you want to insert the catheter, there are different type of tips which have been available. But with our tip, that problem would also be solved, because that urethra would not be that constricted, so that our tip doesn't get inserted. But there are different tips also. There is cowed tip is also there in the market, with catheters having that tip, and the Tayman tip is also there.
Okay.
Usually, normally, most of the catheters have this particular tip, which is straight tip. But in some specialized conditions, the cow tip and the Tayman tip is being used.
Fine.
Yeah. So everything clear till now? I can basically see your faces.
Yeah.
Yeah. So now we'll move on to the technical presentation, which will be having the antimicrobial activity, the bactericidal activity of the Foley balloon catheter. Now, see, the only difference what we have done in our catheter is, we have made the normal catheter as an antimicrobial catheter. Apart from the USPs, what I have told you, the balloon and tip distance and the packing and everything. So the most important attribute for Silverguard antimicrobial Foley balloon catheter is to show that it is antimicrobial in nature, or it is killing the bacteria, or it is not allowing the bacteria to grow in its vicinity. For this, we have done a very basic test, which is normally used to assess the antibacterial activity of any given agent or any given material. For this, we have used three types of bacteria, which is E. coli, Proteus mirabilis, and Staph aureus, gram positive and gram negative bacteria. These are the pathogens which are usually found in urinary tract infections. The initial load which was taken was 10 raised to 6 to 10 raised to 7 cells, that is 1 lakh to 10 lakh cells per ml. Two catheters were used. One was test, that is our catheter, SilverGuard Foley balloon catheter, and the other was control, that is a non-antimicrobial Foley catheter. Now, this entire experiment is called a zone of inhibition assay. Now, what is zone of inhibition? Zone of inhibition is the area near your catheter which doesn't allow the bacteria to grow. Okay, I'll explain you in a better way. Now, see, if you can you see this plate, Petri plate? Can you hear me?
Yeah, yes,
Yeah.
sir.
Yeah. So in this Petri plate, if you can see, these are the test catheters, that is the SilverGuard catheters, and these are the control catheters. Now, zone of inhibition is like a clear zone which is observed near our SilverGuard catheter. In this plate, you can see in this Proteus mirabilis plate also, and you can see here in this Staph aureus plate also, right? So what this concludes is our catheter is not allowing the bacteria to grow in its close vicinity as compared to the control catheter. And this all space, white space, what you're seeing is the bacterial growth. This entire plate, the white color, what you see is the bacterial growth. So here we got a very major conclusion, major observation was being done that SilverGuard antimicrobial Foley catheter is able to kill the bacteria in its close vicinity, demonstrating excellent antimicrobial activity. Now with this, it was very important because we have done a couple of studies with nanoagicide, that is colloidal silver nanoparticles, which we had done, and it shows fantastic activity, everybody knows. But when it is incorporated into the catheter, does it show the antimicrobial activity? And yes, it shows. That's why this test was very important to be done. I'll just show you a slide in which this is the data for the antimicrobial activity of silver nanoparticles, not the catheter, with different bacteria. 12 different type of bacteria we have tested, and we have got zone of inhibition ranging from around 5 mm till 10 mm. Moving further, Milind talked about the biofilm activity. Biofilm is actually a much major concern when the catheter has been used in the patients. And as long as the catheter has been used, when the duration of the use of catheter increases, the biofilm chances of biofilm formation increases. For this, we have done a very high quality imaging, that is scanning electron. You can see these images are scanning electron microscopy images to check whether our catheter actually has a biofilm activity or it has anti-biofilm activity. For this, Staph aureus was used, same culture, concentration of culture was used. Two type of catheters were used. One is SilverGuard antimicrobial catheter, other is the normal control catheter. Now, if you can see here, the left one image, normally the if in during Milind's presentation, in one of the presentation, he had shown the surface of the catheter. It is actually a very good surface for a bacteria to grow because it has a lot of crevices and it is not smooth. So normally you will see biofilm formation on latex catheter more as compared to silicone catheter, what the doctors might have also told you. But in this image, what you can see, this is a control catheter which was immersed in bacteria for 48 hours. And after that, the imaging was done. And you can clearly see that the surface has become smooth. When the surface has become smooth, that indicates that the bacteria have grown upon the surface and a biofilm formation has taken place after 48 hours in control catheter. As compared to SilverGuard catheter, you can clearly see that there are the surface is not smooth. It mimics the typical structure of a latex catheter control, which has a lot of crevices in it and not a smooth surface. This tells you that the bacteria have not grown on SilverGuard Foley catheter at the end of 48 hours. This study was done up to 192 hours, and in 192, you can clearly see that the film has become more and more smooth because there is a huge amount of bacterial growth. But with SilverGuard Foley balloon catheter, it is still has maintained that roughness of the latex that indicates that there is no bacterial growth on the surface. So we concluded that this antimicrobial Foley catheter didn't promote biofilm formation, which is a very important indication for our catheter. Later on, it was interesting for us to know that whether the catheter actually kills the bacteria or it just avoids the bacteria to be placed on the surface. This specific study was done because the competitor products which are available in the market don't kill the bacteria. They just interfere the adherence of the bacteria to the catheter. But we actually wanted to kill the bacteria because even if you don't allow the bacteria to sit on the catheter, it is still there in the vicinity. If not the catheter, it might catch the patient and it can develop into an UTI. So our primary focus was whether we are getting a bacteria killing activity or not. For this, the same thing, E. coli and Staph aureus were used at a particular concentration. We had used artificial urine for it, in which small pieces of catheters were inserted in the artificial urine, which had bacteria in it, and they were kept for 24 hours and 48 hours. After that, they were exposed to a colorimetric dye, which is MTT. It is a very huge name, but you just try to remember the abbreviation, which is an MTT dye. Now, what this MTT dye does is, if there is a live bacteria, if there is a living bacteria, this dye is being changed from yellow to purple color. And if there is no bacteria, or if the bacteria are killed, the dye doesn't change its color and it remains yellow in color. So here I want to ask, what do you expect? Like the test catheters, the culture treated with test catheters would be having which color, either purple or yellow? Anyone can answer? See, I'll repeat again. The principle of MTT dye is, if the bacteria are live, the color changes to purple. If the bacteria are dead, the color remains the same, that is yellow. So when our catheter is being exposed to a culture which has bacteria, what color do you expect? Purple or yellow?
So purple.
It's purple when, yes.
Purple.
No. Think again. If the bacteria are live, then the color is purple.
Yes.
If the bacteria are dead, then the color is yellow.
If it is related to SilverGuard, I think it will be yellow.
Correct. Correct. Because
Achha,
what we are
once the
expecting,
bacteria is dead, then the color will show it.
correct. See,
Okay.
if SilverGuard doesn't has the bacteria killing activity, that means the bacteria are still alive. And if the bacteria are alive, they can use this dye and change their color to purple. But what happens here, you can clearly see in E. coli and in Staph aureus, the color remains yellow. But here you can see that the color is purple. That means the bacteria are not killed, the bacteria are alive. Hence, we concluded with this experiment that SilverGuard antimicrobial Foley balloon catheter has a bacteria killing activity. It kills the bacteria, right? Now, I think this slide has been explained by Milind. I'll just touch upon it because it was in the visualite. So I just thought that I should explain what this actual diagram is about. Normally, the surface of the bacteria is very smooth. You can see it over here. This is the magnified image of this particular surface. You can clearly see it is very smooth. When it has been treated with silver nanoparticles, the membrane is compromised. So bacteria is covered with a membrane. So it has an entire world inside the membrane. When the membrane has been compromised with silver ions or silver nanoparticles, there are small blebs which have been formed. You can clearly see here, 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 and the membrane is being punctured. When the membrane potential is lost, the bacteria is killed, or the bacteria dies. This is again the magnified image. Towards the extreme right is the magnified image of this particular thing, which demonstrates that the silver nanoparticles have bacteria killing activity. And the previous slide which I showed shows that the silver nanoparticles in the antimicrobial Foley balloon catheter also possesses the bacterial killing activity. So this was all about the initial know-how to know whether we are getting the bacterial killing activity or not. Later on, after getting these positive results, we had applied for the test license. We manufactured a small batch, and from that batch we had done extensive studies of biocompatibility. Now what happens is, now I'll just tell you what is biocompatibility. Now when a particular device, medical device, has been made, it might cause irritation, it might cause sensitization. So whether the device which you have made is compatible to the patient, is compatible to the animal, that has been done in biocompatibility studies. First thing. Second thing is, with respect to our catheter, when it is being inserted in the urinary bladder, what happens is it is going to come in contact with the physiological fluids. The first fluid is the urine. It is definitely going to come in contact with the urine. And if there is an injury, it can come in contact with the blood also. So now, if this catheter has been used for a longer time, it can leach out the raw materials from the catheter. That means the latex or the chemicals which are being used or the solvents which are being used to make a medical device, that materials have a possibility of leaching out into the body, and these leachates can have a toxic effect on the body. So to understand the toxic effect, the biocompatibility studies are done. Basically, biocompatibility studies, just to underline it, these are the safety studies done before using it on humans. So is your device safe? Is your device releasing some toxic chemicals which can be harmful to the body? This has been assessed in this biocompatibility studies. So the first study which was done was intracutaneous reactivity, that is skin irritation. And this was done to understand whether the catheter causes any local irritation. Because now you might be knowing that it has been inserted through the urethra till the urinary bladder. So it comes in contact with the mucous membrane of the urethra, and there it can cause an irritation. So just to understand the potential of our SilverGuard antimicrobial foliar catheter, whether it is an irritant or not, this particular study was done. Now, all these biocompatibility studies were done with a standard guideline, which is ISO 10993 guidelines. All these studies have been done in a GLP certified lab, which follows good laboratory practices. This data is not only valid in India, it can be shown across the globe, across the countries. It is valid in all the settings and in all the countries which are in the globe, because it is being done in a good laboratory practice, GLP certified lab. We have all the certifications related to this. Now, in all these biocompatibility studies, what happens is, as I've earlier said, the toxicity of a particular medical device is because of the extractables when it comes in contact with the physiological fluid. That's why in all of these experiments, what we have done is we have extracted it in polar solvent. The catheter was cut into small pieces. It has been extracted into the polar solvent and a non-polar solvent, because both type of solvents are present in the physiological fluid. NaCl, glucose, and all are polar solvents. Non-polar solvents are some any solution which is having some lipids or fats. These are non-polar. So the medical device can come in contact with both the polar and non-polar solvent. That's why an extract was being made with the standard conditions for 72 hours at 52 degrees Celsius. When the extract has been made, a dose of 0.2 ml per site was given intracutaneously, that is under the skin of New Zealand white rabbit. And then it was checked for 24 hours, 48 hours, and 72 hours. Clinical signs were assessed, and intracutaneous reaction was checked, and the body weights were also being checked. Now, this is the diagram where actually the injections were given to a single animal. To the left side, there were polar extract and non-polar extract. To the right side, there was polar control extract and non-polar control extract. After this injections, the animals were observed, and these are the results. What you can clearly see here is the animals were observed for erythema. Erythema is typically when you have a reddening of skin. When a mosquito bites you, the area becomes reddened, and that is because your skin is irritated at that particular point of time. So that's why erythema was checked, and we could see no erythema in all the 4 groups. Edema was checked. Edema is something that is swelling of the skin. That was also not seen till 72 hours. Clinical signs of toxicity like the breathing pattern, how the animal walks, whether it has shed some fur which is present on its back. These are typically come under clinical signs of toxicity. That was also not observed. There was appreciable change in body weight. That is the gain in body weight. This is 1.29. Usually if the material is toxic or if the animal doesn't like it, it doesn't gain weight and it reduces its weight. But in our case, it was not the case. And there was no mortality observed in all the 4 groups. So it was concluded that SilverGuard fully balloon catheter is a non-irritant to New Zealand white rabbits. Now, the second study which we done was the skin sensitization test. Now, this was done because our catheter remains in the body or in the patient for at least 28 days. So it might be a sensitizer, and it might, even if it's not causing an irritation, it might be very sensitive to the skin. So for this, a very sensitive assay, that is guinea pig maximization test, was used, in which 30 guinea pigs were used. The groups were same: polar control, polar test, non-polar control, non-polar test. Extraction was done in polar and non-polar at this defined temperature and time, and the extract was injected. Now, this study went on for 22 days because according to the guideline, you have to do it for 22 days. On the first day, the guinea pig was injected with intradermal injection. On the 8th day, and it was been observed on the regular basis, on the 8th day, there was a topical induction. That means the extract was soaked in a filter paper and it was applied topically on its back for 48 hours. After 48 hours, it was been removed. And on the 22nd day of the experimentation, again, a topical challenge was given. Again, a soaked paper was used and it was applied on the back of the animal, that is the guinea pig. And the scores were taken, whether it is a sensitizer or not sensitizer. And the results were as follows. There were no clinical signs of toxicity. There was no mortality which was seen. These are the 3 observations at day 1, day 8, and day 22. These are the clinical scores which are being taken. Lower the score, the more safer is the material. So usually it is from a grade of 0 to 4. And if you can see, all the values are in the range of 0 to 1. That means it is a non-sensitizer. This experiment was done for 22 days. That's why the percent change in body weight is around 27%. That tells us that the guinea pigs which were being used have gained a weight which is very normal, because this experiment went for 22 days. We concluded that it is a non-sensitizer. The SilverGuard fully balloon catheter is non-sensitizer to the guinea pigs. Another important test which we done was pyrogen test, and this was done according to the US Pharmacopoeia, General Chapter 5151. Now, this test was very important because one of the symptoms of COWT is fever. And here, what we actually wanted to test, that the patient doesn't get a fever because the catheter is inserted, but the patient should get a fever because he might be having an UTI. That's why this test was important, that the increase in temperature is not being caused by our catheters. So for this, New Zealand white rabbits were used, and again the same groups, 4 groups were done. Extraction was done in sodium chloride and blank extract was taken. The extracts were preheated, and then the extract were injected through the marginal ear vein. There is a big vein at the ear of these rabbits, which is very visible, and it is very easily accessible to inject anything you want. So this were being injected through the marginal ear vein, and then the animals were observed for whether there is a rise in body temperature or not. And the results are as follows. This is for the blank extract, and this is for the test item extract. So there were no clinical signs of toxicity. None of the animal which was being incorporated in the experimentation died, and there was no temperature change which was more than 0.5 degrees Celsius. So if the temperature would have been changed by 1 degree or 2 degrees, then it might be concluded that the test material which is being used is pyrogenic in nature. That means it can cause fever to the patient. So here we concluded that the test item meets the requirement of US Pharmacopoeia, and it is non-pyrogenic in nature. So any doubts till now? Can you hear me? Any doubts till now? Are you getting what I'm saying?
Nothing for now, sir.
Okay, you understood the rationale behind doing these studies? That why these studies were chosen and why specifically we are doing this particular study. Because if the device would have been different, there are different battery of tests which had to be done. But as we are doing urinary catheter, irritation, pyrogen testing, toxicity, these tests were focused and these tests were done. So hope you're getting and are in line with me.
Yes, sir. Yes, sir.
Yeah. So just to conclude, we had checked intracutaneous reactivity, skin sensitization, and pyrogenicity testing. And the results were the material is non-irritant, non-sensitizer, and non-pyrogenic in nature. So after doing this brief biocompatibility studies, we were also interested to know the toxicity of this particular material, and different type of toxicities were done. So the first is the in vitro cytotoxicity, in which animal cell lines are used, because uh, while doing toxicity studies, you cannot jump directly using the animal models. First, you have to show it on cell lines. And in this case, we had used L929 mouse fibrillus cell line, which was grown in a medium, which is MEM. And then similarly, extracts were made, and those extracts were given to this particular cell line. And then they were microscopically observed whether the morphology or there is any other abnormal changes which can be seen in this particular cell line. And the results are as follows. This experiment was done in triplicates, that is 3 times. And here we had used a negative control also and a positive control also. So negative control is something which is non-toxic. Positive control is something which is toxic. Now these controls are included basically because just to give a brief idea about how our test item is working, whether it is towards the negative control or whether it is towards the positive control. So microscopic observations were done and gradations are done basically, and the gradations range between 0 to 4. 4 is highly toxic and 0 is non-toxic. So you can see in the test item column, the score is 0, and in the positive control, that is the toxic in nature, it has the score as 4. That means it is very toxic. So the reactivity is none, none, and none, and for the positive control, it is severe. So we concluded that the test item is non-cytotoxic in nature. Another important test which we have done is bacterial reverse mutation. I'll not go in much detail of this because this is a bit complex to understand, but I would highlight a point which Milind said, that during when the ions are released, the ions go and bind to the DNA, and it doesn't allow the replication of the DNA. So what happens is when there is a change in the sequence of the DNA, that is called as mutation. And we wanted to analyze whether our catheters have the mutagenic potential or not. Usually it shouldn't have, but we wanted to test whether it is having or not. And for this, a very sensitive test, which is bacterial reverse mutation test, was used, in which Salmonella typhimurium tester strains are being considered, and E. coli. These are the normal tester strains which are available in the market, and these are the ideal host to do these type of studies. Same protocol was followed. Polar extraction, non-polar extraction was done. Positive control was also being used. And just to give you a brief result about E. coli, similar results we have got with Salmonella typhimurium also. Here you can clearly see that the solvent control, the number of colonies, that is the number of bacteria, is around 74. For the SilverGuard Foley balloon catheter, it is around 76. And for the positive control, here positive control means a substance which is a known mutagen, which has the mutagenic potential. So if it is having a mutagenic potential, definitely the number of colonies are going to increase. So if our colony, the number of colonies are matching similarly with solvent control, and solvent control doesn't have any mutagenic potential, so our result is more closer to the control as compared to the positive control. That's why we have concluded that our catheter is non-mutagenic in nature and it doesn't have any mutagenic potential. Later on, we have done a short study, which is acute systemic toxicity. As this, in this, what we have done is a single dose was given to the mice, and they were observed for 4 days just to check whether there is any systemic toxicity for it. Because initially what we have studied is local irritation, local skin sensitization. But if the extract comes in contact with the blood and it is being circulated in the system, whether it causes any systemic toxicity or not, for that we have done this. And this is with a single dose, what we have used in this particular mice. And the results are like the clinical signs of toxicity were not seen. There was no mortality in any of the group in the test item also. There was appreciable body weight change because the study was done till 4 days, and there was no gross pathology finding. There is no abnormality which was being detected in any of the animals which were being used. The next and the most important test what we have done is a 28-day subchronic systemic toxicity. Now, this test was done because the maximum usage of a catheter which has been allowed by regulatory, the regulatory body of India is 28 days. So that's why we wanted to know that if a catheter has been placed for 28 days, does it cause any toxicity? For this experiment, rats were used and similar 4 groups were made of polar, non-polar extracts. And each day, the mice were being injected with the extract, and then at day 29, that is the end of the experimentation, blood and urine were collected, and the analysis was done of clinical pathology, hematology, clinical chemistry, urine analysis, and histopathology. Now these are the studies which we normally do when a patient gets an UTI. So all these studies were done when these were being injected to the animal. And just to briefly tell you the results, clinical signs of toxicity or mortality was not seen in any of the group. Ophthalmic examination was seen, it was not adverse. In clinical chemistry, we have analyzed 17 different parameters. And again, the scoring was done, and in each of the group, the scores were very low, that is 0. That means it is very normal. Hematology records, 18 parameters were analyzed, and there were no variation across the group. Urine analysis, 16 parameters were analyzed, and there was no change in any of the group. There were no gross observations in the pathology of the sacrificed mice, and histopathology was also done, so that if there are no gross observation scenes, are there any observations which are done under a microscope which are visible? So there were no microscopic changes also being observed. So that's why we conclude that the test item, that is SilverGuard Foley balloon catheter, is non-toxic to the rat, even after giving it for 28 days. And the last study in this biocompatibility is the 28-day implantation study. Normally, this study is not been required by Indian regulations, but further we want to apply it for the US FDA regulations also, and that one of the study which is mandatory is the implantation study. So for this implantation study, what we have done is we have used a reference item, that is Bactiguard. This is the competitor catheter which is available in the market for infection prevention. We compared our catheter with the Bactiguard catheter. Here in each animal, there were 4 pieces of reference catheter implanted and 4 pieces of test catheter, that is the SilverGuard Foley balloon catheter, were implanted. And the study went on for 28 days. And after 28 days, the analysis was done. And these are the brief results. There were no clinical signs of toxicity or mortality in both the groups, that is the competitor and our particular group. Macroscopic observations, that is, which are being done with the naked eye, there was no abnormality detected. And the microscopic observation, the scale was just with comparable to the reference item. So we concluded that there is minimal or no reaction to the subcutaneous tissue after 28 days. So just to give you a brief overview, in this biocompatibility studies, we have seen in vitro cytotoxicity, bacterial reverse mutation, acute systemic toxicity, 28-day subchronic systemic toxicity, and 28-day subcutaneous implantation test. And the product, that is SilverGuard antimicrobial Foley balloon catheter, complies to all of these tests as per the standard guidelines of ISO 10993. So any questions till now, or any part which you haven't understood, or it was just too technical for you guys, just let me know. Hello, are you there?
Oh my God, where is everybody? I think I need to ask everyone to switch
No,
on
no,
their
no,
videos
that's
now.
not-
Yeah, I think so. I think so. I had made
I
them
think so.
aware that
Hello.
Hi, sir.
Yes, Sam, we are there.
you are there.
Yeah,
Definitely.
I'm thinking, where is everybody? Prasad is asking, are you all with me or no? And there is no response.
So just
No, no, yes,
tell
yes,
me,
we are here, we are
how
here.
many tests we have done in biocompatibility and toxicity, whether total?
I think total 5, sir.
No, total I said.
No, total.
Biocompatibility and the toxicity study.
So biocompatibility is 3, and in toxicity it is 1, 2, 3, 4, 5.
Right.
Correct. Yes. So like you are attentive.
Yes, sir, we are.
Because these type of questions you might come across when a doctor asks that this might be toxic, or this might can cause an irritation, or this might cause skin sensitization. So we have thoroughly done these studies, and you can just quote them, or you can just show them these reports that our product is pretty much safe. And this is what we have done with this entire battery of tests which has been done. So should we move ahead?
Yes, sir.
Sure. So we'll move to the third part. Initially, we saw the in-house antimicrobial activity data. Then we saw the biocompatibility and toxicity studies. Now we come to another type of studies, which are called as the performance test. Now, what happens usually is this type of studies, that is the performance test, are not being done by any of the manufacturers, because they assume that this is a normal catheter and it is going to follow all the criteria which has been listed in the particular standard, and they don't bother to do the performance testing also. But performance testing is the most important, because actually it gives you an idea whether your device is going to perform perfectly or not. And as I said in my initial slides, that we want to bring a quality product to the market. That's why we focused more on the performance test also, because our job would have been done by just showing the biocompatibility studies, but we took a one step ahead and we did the performance testing also. This testing was done as per the ASTM F623 guideline, which has been globally been followed to test the performance of the Foley balloon catheter. In this particular guideline, there are 6 different tests, in which first is the flow rate through drainage lumen. So as you know that different catheters, like the different sizes of catheters, have different urine flow rate. And the flow rate is very important, because if a catheter gets blocked, the primary aim of using a catheter, that is the intended use, is to drain the urine. And imagine if the flow rate is not as per the standard guideline, that means your device is not performing the function to which it has to, what it is intended to do. That's why the flow rate is very important, and we have ensured that our flow rate matches what has been by the requirement of the ASTM guideline. The minimum flow rate requirement is for 100 ml per minute, and what the result what we have got is 238.3 ml per minute, which means that the unobstructively the urine flows through our catheter and it has been released in the back, which is the ideal situation. Second thing is balloon integrity and resistance to rupture. As you all know that the balloon is inflated and it is continuously in contact with the urine, that is the moisture, and whether this particular balloon can withstand that particular moisture and for how many days, that has been assessed in this particular test, that is balloon integrity test. So the requirement is the balloon should not burst, neither it should rupture during the deflation test. Okay, so what we have done in this particular thing is we have inflated the balloon and we have kept it in the artificial urine for 7 days at 37 degrees Celsius. And in that time, the balloon should not rupture and the balloon should not burst. Okay, and our SilverGuard Foley balloon catheter has passed this particular test also, because this is very important. As I said, balloon is the most important part in the catheter. And if you can see in this guideline, you will see there are 4 tests dedicated only to the balloon. The third one is inflated balloon response to pull out. And usually this is for the response of forces during clinical use. Because sometimes what happens is if you give by mistake, if the patient just gives a jerk to the catheter, or his urine bag gets stuck somewhere and that creates a jerk, and due to that the balloon might rupture or the catheter might slip out. So to avoid this, we also check how is the balloon response to the pull out, that is the clinical forces are being used in this particular thing. And the requirement is that there should be no deflation or rupture and no passage of entire balloon through the funnel barrel. Now this is an experimental setup. I'll not go into much details. There is a funnel which has been there, and the balloon is inflated and it has been kept in the funnel, and a weight has been attached at the bottom. And the balloon should not come out through the funnel. That is what it requires. This actually ensures that neither the balloon volume is being leaked, nor the balloon is in the position of getting burst or leaking the material which is present inside, or the air, or the solution which is present inside. The fourth thing is balloon volume maintenance. As we have discussed, 30 ml, 50 ml, it is very important that the balloon should retain the volume which has been injected into it, because tell me what would happen if the balloon doesn't retain the volume what you have injected. For example, this is a 14 French catheter, and the balloon what you have inflated is by using 30 ml of distilled water, and the balloon doesn't retain its volume. What would be the consequences? Anybody can tell.
So might cause trauma to the patient.
Yes, correct.
And of course, the number of days of the hospital will increase.
Correct. So as I've earlier also said that the balloon is the most important part. Its integrity has to be maintained and its volume has to be maintained. When the volume of the balloon is if it doesn't maintain the required volume, it would be very small. Okay, and there are chances that it can damage the urethra, or if a simple jerk has been given, that can come out also. So we don't want that to happen. That's why it is very essential that the balloon maintains its volume throughout the catheter use by the patient. The fifth test is balloon shaft and size. This also falls in the acceptable category. And the last and the important thing is deflation reliability. This is used for deflation failure risk of a balloon. So can you just tell me that what might be done in this particular deflation reliability, or why is it important? Excuse me.
Because we need to take out the distilled water what we have inserted, sir, when we have inserted.
Yeah, you need to take out the distilled water, or you need to take out the catheter.
Catheter, yeah.
Correct. First thing was also correct, but the ultimate aim is to remove the catheter, and the balloon holds the catheter. So unless and until you deflate it, it is not going to get removed. So this test is being done, the 6 number test, and our catheter also complies to this particular test. So moving ahead, after this performance testing, what we have done is stability testing. Stability tests are very normal. Just a second, excuse me. So any device which you bring to the market, stability test has to be done. The basic rationale behind doing stability test is when you give an expiry date for your medical device, it is like the device has to function till the last day of its expiry. And to ensure that our device is functioning to the last date of expiry, we do stability testing. Usually there are 2 types of stability testing. One is real time. That is, if you are giving an expiry of 3 years, you have to keep the catheters for 3 years and check what is happening to them. The other thing is an accelerated aging. There is one Arrhenius formula which has temperature and the expiry, the shelf life what you are promoting. And if you feed that particular formula with the details, it will tell you that for how many days, if you keep this device at a particular temperature, you will get the stability for 3 years. So in our case of studies, what we have done is we have done accelerated aging. And in that we have checked the validation of seals, because seal is very important. If the seal is broken, the sterility of the catheter is compromised and it is of no use. So the other thing what we have done is impermeability and continuity of seals. Peeling test. So the catheter which has to be removed has to be peeled out. The upper layer has to be peeled out, the pouch, and then the catheter is removed. The peeling test actually ensures that the force which has been used to peel the test is not too much, so that the doctor has a problem in removing the catheter in case of urgency while inserting the catheter. So that test was also been done, and sterility test also has been done. All these tests were done at the 0th day. That means at the start of the stability testing and at the end of the stability testing. So our catheter has passed all these tests on the 0th day also, and on the 68th day for the accelerated aging. That briefly corresponds to 3 years of shelf life. In the right side, you can see we have done a third-party analysis of sterility and bacterial endotoxin test and abnormal toxicity. So these are the tests which we actually have outsourced for our particular catheter, and the catheter complies to these tests also. After this, now everything moves in stages. Initially you worked in the in-house data, then you have generated data in animals. Now you are actually
excuse me.
ready to have
Sorry.
some patient type of data. So
Hello.
we have done an observational studies for which we call it satellite studies, and these
Prasad?
were done at JIPMER, Pondicherry.
Prasad, can you hear us?
Yes,
There's some
yes, sure.
question, I think, from Sujan, if I'm not wrong.
Yes.
Yes, please go
Sir,
ahead.
sir, the previous slide,
Yeah.
which is the stability test, right?
Yes.
So is it for the expiry of the product?
No.
For the expiry?
See, it is not expiry for the product, but basically what happens is you have to show that the product is in good condition or it can do its intended use till the expiry of the product. So just to give you an layman example, I have manufactured a batch in last year, and the expiry is 3 years down the line. So if it is manufactured in 2020, the expiry is 2023. Now you still have some catheters of that particular batch, and you have a client who is going to use that particular catheter in 2023. That means which is nearing to its shelf life expiry date. So your product should always function in a particular way, or not in a particular way. It should also function 100% what it used to function in the first month of manufacturing till the last month of manufacturing. For that reason, we do the stability testing. You got it?
Yes, yes, yes. So the different companies do different stability tests, right?
Yes, yes.
So because some
Everybody,
companies having,
see, the stability tests are very common. Most of the manufacturers do the stability testing. That is where you ensure that your product is stable to the shelf life what you have promoted. So some people might say my product is stable till five years, or I can, so that I can give an expiry of 5 years. This is how that expiry has been defined. But expiry is one of the part. It is not that entire stability test is focused only on the expiry. It is just that your device should function in the same way on the first day when it is manufactured and on the last day of its shelf life. So there should be no compromise in its functionality. That's why these tests have been done.
right.
Should we move ahead?
Sure, sure.
So we did a couple of organized observational studies. One was done at JIPMER Pondicherry, and the other was done at Bodyline Hospital, in which equal patients were distributed for control and patients using SilverGuard Foley balloon catheter. And the bacteriuria was being analyzed. That means urine in bacteria in urine. So you can clearly see where SilverGuard catheter was used, the chances of bacteriuria were only 13%, but in control it was around 87%. So significantly, SilverGuard Foley balloon catheters has reduced the presence of bacteria in the urine. And the right side data shows that the number of pathogenic bacteria which have been identified. So on control catheter, there were 4 different type of bacteria which were seen. But on SilverGuard, there was only one type of bacteria. Predominantly, it was E. coli, and we found it only on 2 of the patients which were being used. So just to conclude, that significant reduction in the bacteriuria was observed when SilverGuard was used as compared to the control, and less number of pathogens were seen on SilverGuard Foley balloon catheter as compared to the control. Now we have got this data. Just a second. Now here you can see that the amount of bacteriuria cases in SilverGuard are lesser as compared to control. And you can directly link it because it has got silver in it, and the silver ions are killing the bacteria even if they are present. And the average catheterization day in these particular studies were around 8 to 10 days. Okay. So it was very interesting to know whether your catheter is releasing silver ions up to which point, which time point. So we have done an extensive study of 40 days and for the silver release from the catheter, and we could see the silver release from the catheter till the 40th day, and there was a minor dip at the 45th day. So, and this release was actually helpful in killing the bacteria, which we could see in the observational studies, that there is significant reduction in the cases of bacteriuria in SilverGuard as compared to the control. A review article is also been published of our study, which was done at JIPMER, Pondicherry, and the title is Role of Silver Nanoparticle Impregnated SilverGuard Urinary Catheter in Management of Gouty, a Pilot Study. This is being published a few months back, and probably this might be shared with you. This can also be shown to the doctors that a study by using SilverGuard catheter has been done, and we have seen no cases, very less or no cases of bacteriuria. What is this paper actually talks about? Now coming to the clinical trials. So recently we have received an approval from CDSCO to conduct the clinical trials, phase 4 clinical trials for SilverGuard Foley balloon catheter. This is just a brief overview. There would be patient enrollment, there would be randomization. There are two arms. One arm is control arm, the other arm is SilverGuard arm. Each arm is going to have 200 patients. So a total study of 400 patients is to be done. We are going to do the studies at 5 different sites. One is in Hyderabad, the other one is in Lucknow, third one is in Nadiad, Gujarat, fourth one is in Jaipur, and the fifth one is in Ahmedabad. Now let us understand what actually we are going to do in this clinical trial, so that whenever you come across a doctor, when you say that we are doing a clinical trial, they might be asking you, what are your inclusion criteria, what are exclusion criteria, what are your endpoints. They might give you some suggestions also. And apart from clinical trials, we are also looking for some interested doctors who want to do some patient level study. It can be small scale also, around 20-25 patients. We are open to that also, because we want to have studies done at different centers, though these centers are not being used for clinical trial, but at different centers also we are interested to do. And if you come across a doctor who is interested to do these studies, you can directly pitch him that these are the criteria on which we want to judge our catheter, share your inputs, and immediately we can ship the catheters and start the study. So our clinical trial is an open label prospective. That means the patient would be enrolled and then the catheter will be used. It is a randomized clinical trial. That means the doctor will not know to which patient the SilverGuard has to be used or which patient control has to be used, control catheter. It is a multicentric trial. 5 sites are being involved. It is a control trial. That means we are also keeping a control group along with our SilverGuard Foley balloon catheter. And this trial would be done in parallel. That means the control catheter and SilverGuard catheter would be parallelly inserted in the study, and the 2 groups would be studied parallelly for this entire clinical trial. So this study actually involves 3 evaluation points, 3 major evaluation points on which we are going to decide whether it is effective against catheter associated UTI. The first evaluation point is when the catheter has been inserted in the patient. Second is the patient assessment at the catheter removal. And the third is patient assessment at the follow-up day. That means the next day. So if a patient comes, that is day 1 when the catheter has been inserted. If he removes the catheter at the day 3rd, sample will be taken at day 3rd. And on day 4th also sample will be taken. That is the follow-up day after the catheter removal. And the catheter will be removed according to the clinical praxis. So if a patient requires it for a longer time, it can be kept for a longer time. But if a patient requires it for maybe 3 or 4 days, it can be used only for 3 to 4 days and not more than that. Or if there are any cases of infection which occurs, then the catheter has to be removed. Now, the inclusion and exclusion criteria, what we have kept for this particular clinical trial is, we are going to involve adult patients, men and women who are more than 18 years. Then second inclusion criteria is patients who are judged of need of indwelling urethral catheter. Now, only those patients who require urinary catheter for more than 2 days and up to 30 days, those will only be recruited. Because there might be a patient who has gone for a surgery and a catheter has been just inserted for the surgery for a few hours, and then it has been removed. So these type of patients are not included, because as per the definition of COUT, the catheter should remain in the patient for more than 48 hours. So if a patient has a catheter for 1 day and he gets an infection, that is not classified as COUT. If a patient has a catheter for more than 48 hours, he has fever and he has infection, then only it has been categorized as COUT. That's why this is one of the inclusion criteria we have included. And he should sign the informed consent. That is very mandatory, because otherwise the trial would not proceed. Exclusion criteria are like patient receiving prophylactic antibiotics for catheterization or prescribed with antibiotics for catheterization are not included. Any patient having a history of latex or silver hypersensitivity will not be included. Patients with surgical interventions in the urinary tract would also be not included, because this might interfere with the study results according to the investigator criteria. And pregnant and breastfeeding women will also be not included. So these are the exclusion criteria. And next is, this is the study calendar which we are going to follow. As I've told you, there are 3 evaluation points. That is baseline visit, that is during the catheter insertion, catheter removal visit, and the follow-up day. So we are going to judge the patients, or we are going to collect the data on all these important points. That is the vital signs measurement, clinical examination, blood sample, urine culture test would be done. Blood culture test if required, if there is some severe infection, in that case only we are going to do. Catheter removal, total number of days of hospitalization will also be calculated. We are also going to record any adverse or severe adverse events which have been recorded with the catheter, and the use of any antibiotic during the tenure of our clinical trial. The rationale behind doing all these study is like we are focused on one outcome, that whether SilverGuard antimicrobial Foley balloon catheter reduces the incidences of COUT in the catheterized patients. That is the one-line outcome what we are expecting from this type of study. We are also going to include ICU patients in this study, a major number of ICU patients, because that is what input I have got from Abhishek. And we are also going to, the 2 sites which have been added right now, that is the Ahmedabad site and the Jaipur site. We are going to add the intensivist also on the panel, so that they have a good overlook about how the clinical trial progresses and how it is being done. So that's it in this session. I hope you're not bored, and it would be better if you could switch on your videos so that I could just see the reactions on your faces.
I know, actually.
So all good. I find
Yes,
a few
yes, yes.
sleepy faces. Yeah. So any questions or any doubt you are having regarding SilverGuard or the data which I have presented, you can just let me know. See, and you might be meeting doctors, and doctors might be asking you for some data which we might not have generated. So you can directly write an email to me that this is a specific requirement from this particular doctor, and they have also asked us that if we could do such experiments, that experiments can also be done at our end. If it is feasible, definitely we can do it. If it is not feasible, we can get it done from